వెల్కమ్ టు బ్రేకింగ్ న్యూస్ హెల్త్ బులెటిన్. మారుతున్న జీవనశైలి కాలుష్యం తీవ్రత వల్ల గుండె జబ్బుల సంఖ్య రోజురోజుకు పెరిగిపోతుంది. దీంతో ప్రమాదకరమైన గుండె జబ్బులు మనిషిని వెంటాడుతున్నాయి. గుండె జబ్బులు చిన్న పెద్ద వయసుతో సంబంధం లేకుండా ఏ వయసు వారికైనా వస్తున్నాయి. అందుకే గుండె జబ్బులు వాటి నివారణకు సంబంధించిన అంశాల పట్ల అందరికీ అవగాహన పెరగాలి. వరల్డ్ హార్ట్ డే సందర్భంగా సీనియర్ కన్సల్టెంట్ కార్డియాలజిస్ట్ డాక్టర్ సునీల్ కుమార్ బ్రేకింగ్ న్యూస్ 24/7 వ్యూయర్స్ కు విలువైన సలహాలు అందిస్తున్నారు.
Hi, I am Dr. Sunil Kumar. I am a cardiologist working at Medinova and Apollo hospitals. On the occasion of the World Heart Day, which falls on the 29th of September, I would like to highlight before you a few facts about coronary artery disease. The theme of the World Heart Day this year is a heart-healthy environment at home, at work, and at play. This is important to follow because Indians as such are highly prone to coronary artery disease, and heart attacks and heart-related ailments have now become the #1 killers in our country. Why does this happen? Of course, we have a genetic tendency to increased coronary artery disease. But in addition to genetic tendency, there are certain risk factors which contribute to the increasing incidence of coronary artery disease. What are these risk factors? The most important is smoking. Smoking increases risk of heart disease to a very great extent, and even if you stop smoking today, then only after a couple of years then the risk will come down. Secondly, diabetes. Diabetes accounts for a large population in our country, and these populations are at increased risk for heart disease. It is important to diagnose, treat, and follow the doctor's recommendations in control of diabetes to avoid complications like heart disease. Thirdly, hypertension, high blood pressure. This is a silent killer. You won't know that you're suffering from high blood pressure unless you get checked up. So please get your blood pressures checked up regularly, and if they are high, please get them controlled with medications, diet, and various other lifestyle modifications. But today, the most important thing that is happening in our country is the sedentary lifestyle. People are not walking, the weights are increasing, and the diet has become heavily westernized, and more of saturated fats, oily foods, and infrequent meals. Particularly in the IT sector, you can see that people are working long hours, particularly at nights and irregular hours, and even the diet that is supplied to them in their companies are full of oils and unhealthy things. So what has to be done is that we have to modify our lifestyles to see that we exercise enough. A recommended exercise regime is to do walking 30 to 40 minutes per day for at least 5 days in a week. It need not be jogging or running. Simple walking is enough. Keep your weight down. Don't be obese. And then we can see that the incidence of heart disease can come down if we control all these risk factors. What is coronary artery disease? For the heart to function in a healthy way, it has to receive adequate amount of blood, and this it does by way of 3 tubes that run on the surface of the heart. These are called the coronary arteries. As long as the tubes are clean and blood flows through them properly, then the heart will function nicely. But because of the risk factors that we have talked about, like diabetes, hypertension, smoking, obesity, sedentary lifestyle, the blockages start developing inside the coronary arteries, and then the problem starts, and this can lead to severe problems if it is undetected. So how can we detect early coronary artery disease? If you're undergoing routine tests, you can diagnose coronary artery disease at a very early stage. When you first visit a doctor for routine test, he will order for you tests like blood sugar and lipid profile, which include cholesterol to know bad cholesterol, triglycerides, and other things which are detrimental to the heart. Having done the blood test, there are few other tests which are important in diagnosing coronary artery disease. For example, the echocardiography will show us whether the heart is functioning properly or not. It will show us the power of the heart, and also the blood supply in the valves. Valves are different from coronary arteries. Coronary arteries are the channels for blood supply to the heart. To diagnose blockages inside that, we have to subject a patient to what is called a treadmill test, also commonly called a stress test, where we make the person walk on the treadmill and look for changes in the ECG. If the treadmill test shows that there are changes in the ECG, then we can start suspecting blockages at a very early stage. And if the treadmill test is positive, then we ask the patient to undergo further investigations. The standard investigation, of course, is coronary angiogram, where we inject dye into the heart and see the circulation and the blockages. But a very recent technology that has now come up to diagnose coronary artery disease is called a CT coronary angiography, where the same thing, the arteries of the heart are seen by way of a fast CT, 64 slice CT, and we can get very good images of the coronary artery disease to diagnose or rule out the blockages inside the heart. If you detect blockages in the angiogram, then what is to be done? Not every case which has blockages is subjected to surgery or procedures. Many a times, a good medical treatment, healthy lifestyle, and control of diabetes and hypertension is enough as a treatment for coronary artery disease. But if the blockages are severe, then we can subject the patient to procedures. The commonest procedure that's done is called the PTCA, or the angioplasty, where we put a balloon inside the artery and open up the blockage, and to make it remain open, we put what is called a stent, which is a metal tube inside the heart, and then the blockages are removed and the circulation is restored. Unfortunately, many patients come to us at a late stage where all the three arteries have developed blockages. If that happens, then the patient has to go for what is called coronary artery bypass surgery, where we put new tubes and the circulation is restored. But having said that, these are treatments which will make the patient adopt a normal lifestyle. Once he undergoes this procedure, he becomes practically normal. What are the symptoms of heart disease? The commonest symptom is chest pain, and the pain will be here behind the breastbone, and this is a crushing type of pain, particularly which comes on walking or climbing stairs. If you get this, please don't say that it is a gas problem or anything. Please approach your doctor and undergo these tests so that the blockages can be diagnosed at an early stage. Unfortunately, some people develop a heart attack as a first symptom of heart disease, but now we have got very good treatments for heart attacks. That is, we've got special medications which can bust the clot that forms inside the heart. Also, angioplasty and stenting can be done when patients come to us with heart attack at an early stage. So I've till now talked about the various aspects of coronary artery disease. And you can realize that there's nothing to worry about if you come to a doctor at an early stage, adopt a healthy lifestyle, and change your dietary habits, then everything will be controlled. And that is the reason why the theme of the World Heart Day this time is a heart-healthy environment at home, work or play. At home, you should change your diet. Play means you should exercise enough. And of course, at workplace, you should see that you eat a good, healthy diet and don't take too much stress from the work environment that you have. So a heart healthy environment at work, play and home is what we should all adopt. Yep, that's all.
ఇది ఇవాల్టి బ్రేకింగ్ న్యూస్ హెల్త్ బులెటిన్. మరో హెల్త్ బులెటిన్ లో మళ్ళీ కలుసుకుందాం. Until then, keep watching Breaking News 24/7. Breaking news for you, with you always.